So it will be fourth unit, which is disorders and health problems of a child. In the syllabus, as you all can see, is the fourth unit. Under that, first topic is infancy. Today we will see failure to thrive. First of all, failure to thrive. What do you mean by failure to thrive? Failure means what? Lack of success on anything which is unsuccessful. So and thrive means what? Thriving means a person who is having difficulty in growing or developing. So failure to thrive, commonly it will be failure to grow or to maintain a particular baby's or a child's weight. So it will be as failure to thrive accounts for 1 to 5% of pediatric hospitalization in children under 1 year of age. And FTT, the weight falls below FTT is failure to thrive. Weight falls below 5th percentile of the child's age. So FTT means what? Failure to thrive. It is slow physical development in a baby or in a child. It is slow development or slow physical development. So which can be caused by a baby which is not having enough nutrition. So what do you mean by the term which is written over here, which is failure to thrive? The weight falls below 5th percentile for the child's age, which means weight falls below 5th percentile. I have taught you all earlier as well. I hope you all remember, which is what is percentile and all. So a baby who's on the 5th who lies on the 5th percentile weighs less than 95% of the other babies of that same age group. Moving on further to the definition which I had taken from a textbook of Wong's, that is growth failure or failure to thrive. You can call both. You can call it growth failure. You can call failure to thrive. It is a sign of inadequate growth, which means a particular baby is not growing up properly from inability to obtain or use calories required for the growth. Ask people to please join early because now they are waiting in the lobby. I have to again stop the presentation and then I have to go and accept everyone now. 1 second. Kindly come on time. Although we had started 5 minutes late only. So we were seeing growth failure or failure to thrive. It's a sign of inadequate growth resulting from inability to maintain or obtain or use calories which are required for the growth. As I told, it's a slow physical development in a baby's growth. So same thing is written. Another definition which is which is failure to thrive refers to a condition where the physical growth of a child is less than expected. As I told you all, how much the child should grow, that much the child is not growing. So that is what it is a deficient in that particular baby, usually which lies below the 3rd or the 5th percentile, or when a child has a significant loss of weight in a short period of time. Next is there's an etiology. First of all, etiology is based, which is causes. Causes are based first in general. We have 3, which are organic failure to thrive, non-organic failure to thrive, and the last is idiopathic failure to thrive. There are others as well, which are intrinsic and extrinsic factors. First, we'll see organic failure to thrive. What do you understand by organic failure to thrive? It occurs when there is an underlying medical cause. अगर कोई medical cause पहले से है, that particular time में organic failure to thrive they will be having. Next will be non-organic failure to thrive. जहाँ पर मेडिकल कॉज का इन्वॉल्वमेंट है दैट विल बी ऑर्गेनिक. जहां पे मेडिकल कॉज की कोई इन्वॉल्वमेंट नहीं है दैट विल बी नॉन ऑर्गेनिक. सो हाउ you all will be writing? Organic means occurs when there is no underlying when there is an underlying medical condition or a medical cause. कोई medical cause है उसके पीछे, that will be organic failure. Non-organic में occurs when a child has no known medical condition and without having any medical condition still they are having poor growth. So mainly non-organic failure to thrive occurs in a child who is usually younger than 2 years of age and they still have no medical condition that is causing the poor growth. Next is idiopathic, that is everybody knows, unknown cause of failure to thrive. Seeing the first one, organic failure to thrive, we have certain conditions under which occurs, which has some underlying medical causes. Under that, first is GERD, GERD, that is gastroesophageal reflux disease. This is what it is, a sort of a GI disorder जिसमें stomach acid or else the bile जो bile है, bile will be irritating the food pipes linings, that is GERD. Next is malabsorption syndrome, that is what एक ऐसा condition है malabsorption syndrome that prevent the absorption of the nutrients through the small intestine. Next is cystic fibrosis. That is what? It's a life-threatening disorder that damages the lungs and the digestive system. Okay. What is cystic fibrosis? That is a life-threatening disorder that will be damaging the lungs and the digestive system. Next is congenital heart defects. Under that, what, as you all know, congenital means by birth. So it is a condition which is present at birth and which will be affecting the baby's heart or structure of the baby's heart and the function, how it works. Both it will be affecting. It will be affecting the structure as well as the function. Are you all getting? Nobody is responding. Are you all getting? How far we have seen? You all got everything? Anyone can unmute yourself and you can respond if you all are getting.
Yes, ma'am.
Okay.
Okay, ma'am.
Okay, fine. Next is tuberculosis. Everybody is aware of it. That is a serious infection, which is what? A bacterial disease, which is mainly affecting the lungs. Next is juvenile diabetes mellitus. As the name itself suggests, juvenile. Juvenile means children. So, children associated diabetes mellitus, it is a chronic condition in children in which the pancreas produces no insulin or very less insulin. Next is liver abscess. Abscess means what? Pus collection. So, pus collection where or a mass filled with pus which is present inside the liver. I hope you all have got with the topic. The first one is organic failure to thrive. Till how far we have seen, till so far we have seen failure to thrive. Under that introduction, what is generally failure to thrive? Then growth and what is the definition of growth failure or failure to thrive? Then we had seen etiology, and then that we had seen first organic failure to thrive. The second one is non-organic failure to thrive. Under that, first is inadequate nutritional information. As I told you all, first only जिसमें underlying medical cause की involvement है, that is organic. Non-organic means कोई भी medical condition is not involved. But still, maybe some medical condition is involved, but proper information is not being given about it. So inadequate nutritional information, किसी को knowledge ही नहीं है, तो what they will give? Nutrition. Then disturbances in the mother and the child attachment. Mother and the baby ki attachment mein certain differences are there. Then next is psychopathic personality of the mother. I have told you all this, we had discussed in the earlier unit as well. Psychopath, I have told you all. Who are psychopaths? They are any individual, those who are suffering from any sort of mental disorder or and that with that disorder also they are showing any sort of abnormal behavior in their nature. So similarly, psychopathic personalities of the mothers, they will be like, for sometimes they will not be accepting the baby as their own, or else sometimes they will not be familiar with their own babies. Next is deficiency in maternal care. Mother is not able to provide the proper care what she has to provide. Next is older child with eating disorder. Any child who is having eating disorders such as pica, like you all might have heard or might have seen babies eating wall paints, or babies eating some non-nutritive substances. Anything which is non-nutritive in nature they are eating, that will be under eating disorders. Next is idiopathic, as you all know, unknown cause. Failure to thrive happening because of any idiopathic or an unknown cause. Next is other etiologies will be intrinsic and extrinsic factors. Intrinsic means and extrinsic means. Intrinsic means what is happening within. Extrinsic within the body. Extrinsic factors means whatever is happening outside the body. So first is defects in absorption. Defects in absorption means body में ही absorb होने में कुछ issue है. That is why the baby's body is not accepting or not absorbing certain nutrients in the body. It can be impaired nutrient absorption, where the nutrients are already not absorbing by the baby's body. Okay, next is metabolic disorder. Metabolic means, metabolic word has come from where? It has been come from the word metabolism. That is what any what you call chemical process that occurs within a particular person's body, any chemical process that is under metabolism. So it will occur when, metabolic disorders will occur when abnormal chemical reactions will take place in a person's body or in a baby's body that disrupts or discontinues the process, whatever process is going on. So for that metabolic disorders, we have certain examples. Those
हेलो
are
मैम।
weight loss. Yeah.
मैम आप थोड़ा हिंदी में समझाइए, हमें थोड़ा समझ में नहीं आ रहा।
क्या नहीं समझा, बोलो। इसके पहले का y'all got?
यस मैम।
कहाँ तक नहीं समझा ये बोलो।
मैम कंजेनाइटल और नॉन कंजेनाइटल तो समझ में आया, उसके बाद का समझ में नहीं आया हमें।
कंजेनाइटल नहीं है, ऑर्गेनिक था पहले तो। रीड केयरफुली।
यस यस मैम। ऑर्गेनिक।
Organic failure to thrive tha, then non-organic failure to thrive, then idiopathic. After that we had seen etiology. वो etiology का second part, that is intrinsic and extrinsic. Intrinsic का meaning क्या होता है? कुछ भी चीज which is happening inside your body, बॉडी के अंदर और एक बॉडी के बाहर। बॉडी के अंदर क्या होगा, जो भी प्रोसेस बॉडी के अंदर चल रहे हैं उसमें कुछ डिफेक्ट। सो फर्स्ट डिफेक्ट इज डिफेक्ट इन अब्जॉर्प्शन। बॉडी में जो न्यूट्रिएंट्स का नीड है वो बॉडी अब्जॉर्ब ही नहीं कर पा रहा है। बिकॉज ऑफ व्हाट? क्योंकि बॉडी की न्यूट्रिएंट अब्जॉर्प्शन और एल्स अच्छे से काम नहीं कर रहा है, विच यू कॉल इम्पेयर्ड न्यूट्रिएंट अब्जॉर्प्शन, जहां पर न्यूट्रिएंट अब्जॉर्ब नहीं हो रही है। नेक्स्ट पॉइंट विल बी मेटाबॉलिक डिसऑर्डर्स। मेटाबॉलिक मींस, मेटाबॉलिक वर्ड किधर से आ गई? मेटाबॉलिज्म से। सो मेटाबॉलिज्म ही वीक है और मेटाबॉलिक डिसऑर्डर्स में मेटाबॉलिज्म अच्छे से काम नहीं कर रही है। दैट इज केमिकल प्रोसेसेस जो बॉडी में काम करते हैं, फूड लेना और अच्छी चीज को रखना, बाकी चीज को बाहर करना, दैट इज ऑल मेटाबॉलिज्म। सो जब कब अब नॉर्मल होगी इन योर बॉडी? जब कोई भी केमिकल रिएक्शन बॉडी में नहीं हो रही है दैट पर्टिकुलर टाइम। सो दैट विल बी अंडर मेटाबॉलिक डिसऑर्डर्स। अभी समझ में आ रही है?
यस मैम।
हाँ, नेक्स्ट इज क्रॉनिक डिसऑर्डर्स। क्रॉनिक मींस व्हाट?
मैम लॉन्ग टाइम के लिए।
हाँ, very good. So that disorders will be including what all? Any disorder which is related to heart diseases, cardiovascular diseases which you say, then diabetes or cancer. These all will be intrinsic factors जो अंदर से आ रहे हैं। Next will be extrinsic factors. Extrinsic mean बाहर से आप किस चीज को कंट्रोल में कर सकते हैं, like inadequate nutritional intake, खा ही नहीं रहे हैं और बेबीज आर नॉट बीन फेड प्रॉपरली। यहाँ पर खा कौन नहीं रहा है? इफ द मदर इज नॉट ईटिंग, मदर इज नॉट टेकिंग केयर ऑफ हर पर्टिकुलर न्यूट्रिशन, तो वो बेबी को क्या कराएंगे? सो दैट इज इनएडिक्वेट न्यूट्रिशनल इनटेक, और एल्स बेबी हिमसेल्फ इज नॉट टेकिंग इनिशिएटिव, खिला रहे हैं फिर भी नहीं खा रहे हैं। नेक्स्ट इज social and environmental deprivation. First of all, you all tell what do you mean by deprivation? Deprivation का meaning मालूम है आपको? Yes or no? At least y'all can say if y'all don't know also.
नो मैम।
Okay, deprivation means withdrawal from anything. Social or environmental deprivation. You call it mentally deprived or socially deprived means withdrawal, social withdrawal. अब social withdrawal और environmental withdrawal कैसे होगी babies में, children में? First of all, when social withdrawal कब होगा? जब उनके पास एक्सेस ही नहीं होगी रिसोर्सेज के लिए। एक्सेस कब नहीं होती किसी के पास पे? व्हेन दे आर इन पॉवर्टी, गरीब है, उनके पास एक्सेस ही नहीं है बाकी लोगों से बात करने के लिए। तो अगर कोई, इफ समबडी इज नॉट वेल टू डू, एक वेल टू डू फैमिली से नहीं है, तो उनको society, how they do it, they are socially withdrawal or socially deprived. So social deprivation हो जाती है कि बाहर जाना ही नहीं है क्योंकि हमें कोई पूछेंगे नहीं, because we are from a weaker section. Next is environmental deprivation, means कब absence of environmental condition, जो कि environmental condition does what, they stimulates the intellectual, behavioral, or what, intellectual and behavioral development. So if people will not be socially, mentally, physically fit or financially fit, they will not be, mostly they are not being accepted by the people of the society. So that will be another factor. खाने के लिए नहीं है तो they will not grow naturally. So these were two. First was intrinsic, next was extrinsic. Other factors as well, as I told you all, other factors में कौन होंगे? Poverty, गरीबी. Then inadequate nutritional knowledge, knowledge ही नहीं है कि क्या खाने से क्या होना है. Some people don't have money, some people do have money but they don't know what to eat, what not to. पैसा है तो they are eating any substance which is not providing any sort of nutrients in the particular baby's body. Next is family stress for the family. एक घर में खूब सारे बच्चे हैं, so that particular person who is the breadwinner of the family, एक ही जो भी earn कर रहा है वो उसको stress है. Then feeding resistance means, as I told you all earlier as well, resistance का meaning क्या होता है? It is opposed to something, मतलब कुछ करने के लिए रोक देना. So feeding resistance कौन होंगे? The children those who are preterm, or children those who are on ventilator, children those who are on incubators. Those उनको resist करते हैं ना, उनको माउथ से कुछ भी नहीं दे रहे हैं. They are being only dependent on what? They are dependent on the tubes, that is orogastric और nasogastric tube. So जब ट्यूब दे देंगे तो माउथ से कुछ नहीं न्यूट्रिएंट दे रहे हैं ना, that is why that is feeding resistance. Next is insufficient breast milk. At times in babies or at times in mothers, some mothers are unable to breastfeed because they don't have much lactation, they don't lactate more. So that is a insufficient breast milk. Mother is not able to lactate, mother is no non lactate, or mother is lactating but not up to the mark. जितना चाहिए बेबी को फीड उतना लैक्टेशन नहीं हो रहा है. So that is insufficient breast milk. I hope you all got up till here. So far we have seen only the definition, etiologies, which were divided in three parts, which was first is organic failure to thrive, non-organic failure to thrive, idiopathic failure to thrive. After that, intrinsic and extrinsic, and other factors as in general. Next is clinical manifestation. First is an overall clinical manifestation. उसमें हम देखेंगे failure to gain weight despite adequate caloric intake. अभी वेट इंक्रीज ही नहीं हो रहा है. दे आर नॉट इंक्रीजिंग इन स्पाइट ऑफ गिविंग देम. उनको जितना भी जरूरत है उतना कैलोरी इनटेक उनको मिल रही है, बट स्टिल उनकी वेट गेन नहीं हो रही है. नेक्स्ट इज organomegaly or lymphadenopathy. Organomegaly means enlargement of any organ in the body. Any organ can be, it can be liver, it can be spleen, it can be limbs. The next is lymphadenopathy. That is again an enlargement of the lymph nodes. In response to what? क्यों enlargement हो रही है? You can clearly see in the very first picture, that is lymph nodes enlargement. क्यों हो रही है? देख के पता चल रही है कैसे हो रही है? Any sort of infection, regional infection. Regional means at a particular place. तो वो कहाँ पे है? Just behind the ears. So उस region में उनको क्या हो रही है? Any sort of inflammation or infection, that will be under lymphadenopathy. Next is recurrent or severe respiratory problems. बार बार हो रही है और severe respiratory issues if a child is facing, that will be coming under recurrent or severe respiratory problem. बार बार होने वाली कौन सी respiratory issues हो सकती है babies को? Breathing issues it can be, which we had seen earlier, or else pneumonia, which we had seen. You all also please involved in the process. अगर आप बोलेंगे नहीं तो I will not get. Next is recurrent vomiting, diarrhea or dehydration. बार बार vomiting हो रही है, बार बार diarrhea हो रहा है, बार बार because of that the baby is getting dehydrated. These are all general normal symptoms. Next we will be seeing according to system wise कौन से sign and symptoms होती है. Very first is general. Overall will be Loss of subcutaneous fat. In the very first picture you can see a very thin lean baby जिसके ribs भी दिख रहे हैं. So that is what? Loss of subcutaneous fat. Fat नहीं है body में. Then next is wasted body. Wasted body means what? Muscle wasting. Don't pronounce as wasted body. That is not wasted body, that is wasted body. Wasting, it is known as muscle wasting. Wasted body over here means weaker body. फर्स्ट पिक्चर में देख के लग रहा है कि अभी भगने लगेगा बेबी. Say first, when the very first picture on the right side, the right corner, right upper corner, वो पिक्चर जो बेबी इज लाइंग उसको देख के लग रहा है कि बेबी इज ऑल राइट and baby is
No,
full
ma'am.
healthy. So that is a
No, ma'am.
wasted baby.
No, ma'am.
Wasted baby. Wasted means what? Weaker baby, जो बहुत ही ज्यादा weak है, कोई subcutaneous fat नहीं है, body में कोई भी fat नहीं है, very lean and thin. उसके legs and arms you can see, thin arms with thin legs. Next is a large stomach. Stomach है large but no muscle fat, only filled with fluid or something or the other. Next is red, cold and wet hands and legs. एकदम hands red होंगे, cold होंगे, and they will be having a sweatery hands, which you can say precipitating hands or legs. हाथ और पैर में हमेशा they will be wetness will be there. Understood? Large stomach of the baby you can see in the second picture. Very clearly it is shown. Next is cardiac and pulmonary. Cardiac means heart se related, pulmonary means lung se related. So cardiac and pulmonary, first is a cyanosis. In the second picture you can see bluish discoloration of the fingers of the baby. That is cyanosis. Clubbing, you see nail clubbing. Clubbing means what? Any abnormal shaped nail beds or rounded shape. बेबीज के नेल्स जो है नॉर्मली हमारे स्पून शेप्ड आपने देखे हैं, लेकिन कौन से शेप के abnormal हैं? That those are rounded in nature and they are very abnormal in nature. Nail beds, nail दिखने में rounded, so that is clubbing. Next is respiratory distress, any discomfort respiration में, that is distress I told you all. So respiratory discomfort, difficulty in breathing in children. Then murmurs. Murmurs are what? Heart murmurs. You all might be familiar with this. That's the sound of the blood flowing. Those are all, those comes under murmurs. So under this we had seen cardiac and pulmonary clinical manifestation. Under that we had seen cyanosis, clubbing, respiratory distress, murmurs. Before that we had seen general sign and symptoms, which were loss of fat in the subcutaneous area, then wasted body, stomach large, cold, red, wet hands and the feet. Next is abdomen. Abdomen will be distended and organomegaly will be present. This organomegaly, as I told, any enlargement of any organ. It can be liver, it can be spleen, it can be any lymph area. Abdominal distension. Distension is what? Bloating or swelling in the abdomen area. In the very first picture you can see abdominal distension, which shows bloated belly or abdomen, or else swelling in the abdomen, you can say. You all can see the very first picture that depicts abdominal distension.
Yes, ma'am.
Okay. Next is skin and hair. In the second picture you can see about hair, skin and hair. In the alopecia. Alopecia, y'all are familiar. It can be in the second picture, y'all can see clearly partial or it can be complete absence of hair, which is also known as baldness. So that is alopecia in the second picture. Or it can be, or second is jaundice. Jaundice is what? Yellowish skin discoloration of the particular baby's body, which can be caused by the bilirubin, rise in the level of bilirubin in the blood. Next is dry and scaly skin. Second picture baby, you can see very dry sort of a skin and very thin sort of a skin of the particular baby. Baby is also looking very fine. No muscle fat in the baby's body. Next is any nutritional disorders. Nutritional means what? Anything related to the nutrients, as we had seen earlier, which are not being absorbed in the baby's body. First is kwashiorkor, second is marasmus. Kwashiorkor means what? Both are nutritional deficiency disorders, whether it is kwashiorkor, whether it is marasmus. But kwashiorkor is what? It is a nutritional deficiency disorder which results from what? Very severe protein deficiency. किसमें होगी? kwashiorkor में. अगर जो भी baby is suffering from kwashiorkor will be having emaciated appearance all over the body. First picture दिख रही है, कोई भी fatty नहीं है, emaciated or you can say wasted. कोई बॉडी में एक भी फैट नहीं, कुछ भी फैट नहीं बेबी में, सो दे विल बी अपियरिंग लाइक दैट इज क्वाशियोकर. और ऐसे बेबीज को, क्वाशियोकर बेबीज को, दे विल बी हैविंग अ टाइप ऑफ स्वेलिंग. कहाँ कहाँ पे? एंकल में, बेली में, फीट में, एंकल में, बेली में, ये लोग को स्वेलिंग होगा. बेसिकली क्वाशियोकर किस बच्चे लोगों को होगा? जो बच्चे आप रूरल एरिया में, गांव में, सबर्ब एरियाज में जो मिलेंगे, दे आर मोर प्रोन टू दिस. बिकॉज व्हाई? बिकॉज मोस्ट ऑफ द चिल्ड्रन ओवर देयर, उनके पेरेंट्स आर नॉट वेल टू डू, अभी भी नहीं काम हो रहा है, और दे हैव मेनी चिल्ड्रन, तो सबको उतना न्यूट्रिशन नहीं मिल पा रही है. When we talk about marasmus, it is again, as I told you all, it is again a type of nutritional deficiency disorders जो सब बच्चों में दिखता है. But it can be life threatening अगर टाइम से पहले पता नहीं चल पाई तो. ये क्यों होता है? बिकॉज ऑफ डेफिशिएंसी ऑफ न्यूट्रिएंट्स मतलब इसमें दो तीन होते हैं, लाइक कार्बोहाइड्रेट्स, फैट्स एंड प्रोटीन. क्वाशियोकर में क्या है? प्रोटीन डेफिशिएंसी ऑल ओवर. मरासमस में तीन चीजें इंक्लूड हो जाता है आपकी, दैट इज प्रोटीन, कार्बोहाइड्रेट्स एंड फैट. और ये कब होता है? दोनों ही होता है किसी को पॉवर्टी में है अगर तो. बट मरासमस इज मेनली ड्यू टू फूड स्कैरसिटी. घर में खाना नहीं है, बिल्कुल भी खाना नहीं है, बहुत ही ज्यादा गरीबी है. इन दैट केस marasmus does happen. Kwashiorkor also, but marasmus ज्यादा है because उसमें तीन चीजों की involvement है, that is protein, carbohydrates and fats. Understood? Any problem you all have in the difference between kwashiorkor and marasmus?
No, ma'am.
Okay. Next is zinc और iron deficiency. Any deficiency which includes iron नहीं खा रहा है कोई, किसी ने नहीं खाया या उसको नहीं मिल रहा है, कोई fruits नहीं मिल रहा है, iron and zinc supplements नहीं मिले, in that case they can be. Important is are these two, that is I have briefed so well, kwashiorkor and marasmus. Next is psychological deprivation or description, you can say. Psychological description में psychological related to intellectual, that is sadness एकदम दुखी रहेंगे, कोई तो भी इशू हो गया, और लाइक देन एक्सप्रेशनलेस फेस, कोई एक्सप्रेशन नहीं, इधर दे आर हैप्पी, दे आर सैड. y'all can hear?
Yes, ma'am.
Yes, ma'am.
Okay. Expressionless face will be there, they will be lethargic, बहुत वीक ही रहेंगे हर टाइम, एकदम वीक नेचर दे विल शो. कभी भी दे यू विल नॉट फील दैट दिस चिल्ड्रन आर एनर्जेटिक, हमेशा लेजी दे विल बी. withdrawal they will be having, detachment they will be having. withdrawal means कोई भी चीज को नहीं बोल देंगे. they will not be attached with the people, like कोई friends होंगे उनसे ज्यादा मतलब ही नहीं रखना. अनरिस्पॉन्सिव बिहेवियर, अनरिस्पॉन्सिवनेस, कोई भी. नेक्स्ट सेकेंड पिक्चर यू कैन सी, कुछ भी बोलो, कोई भी बात कर रहा है, दे विल बी नॉट रिएक्टिंग, ओनली दे विल बी क्वाइटली सिटिंग इन वन पर्टिकुलर स्टेट. दैट विल बी लीडिंग देम टू डिप्रेशन, एकदम डिप्रेस्ड हो जाएंगे, बिकॉज दे विल नॉट बी मिंगलिंग विद अदर पीपल, दे विल नॉट बी शेयरिंग विद देयर इश्यूज. इन द सेकेंड पिक्चर ब्लड विजन में आप देखो, दूसरे लोग बच्चे दे आर टॉकिंग एंड दीज पीपल आर सिटिंग ऑल अलोन. जब भी पेरेंट्स के साथ ऑल्सो दे आर गोइंग, दे आर अ बिट एंड सॉर्ट ऑफ एन इंट्रोवर्ट, पीछे ही रहेंगे. देन लिटिल और नो स्माइलिंग, कभी भी कोई जोक भी पास करेंगे तो दे विल नॉट बी स्माइलिंग, और एल्स इफ दे विल बी स्माइलिंग ऑल्सो दे विल नॉट शो मच इंटरेस्ट टुवर्ड्स दैट एज वेल. लैक ऑफ प्रॉपर स्ट्रेंज एंजाइटी, कोई दूसरे भी आ जाएंगे तो उनके साथ दे विल नॉट mingle properly, they will try to hide or they will not try to talk or interact much with them. So this is psychological description, that is normal. Look, if we like you all also, this just an example, don't include in this, that you all also, if you all feel inferiority because of some other, like if you don't have that dress or you want that, or people of your batch or your peer mates are having that, and so you also have a sort of an inferiority complex that unke paas hai mere paas nahi hai, so that complex is being generated, like, right? Similarly is the same with the children. They have suffered certain issues such as nutritional disorders also. They are not good, not from the good to do family, so that is why they do develop all this. That is what expressionless face, sadness, lethargic, unresponsive behavior, depressed they will be, no smiling face they will have, or they will be having lack, they may have means lack of proper stranger anxiety. कोई भी दूर से आ जाएंगे तो उनको they will not be reacting much. Next is developmental retardation as well. Develop ही नहीं हो पाएंगे. The development will be retarded, or you can call slow development. That motor, language, social, intellectual, everything will be. Motor means all your skills, motor skills will be not be developing properly. देखो first picture में you can see कुछ भी तो if they are eating also they are spilling it. और जितना बड़ा बच्चे के लिए like in the second picture you can see mother is teaching toddler ABCD. First of all, infancy में ही most of the children they do get, but she's teaching more than a 2 or 2.5 year kid about it, so this will all be retarded. In every manner their growth will be retarded, development as well as growth. It is included in developmental retardation only, that is like this slide as well, that is unresponsiveness. कोई response ही नहीं होगा because they are themselves. In the pictures you can see first, second and the third, mother is trying to see the baby, but the baby is very unresponsive and in his or her own world. Then next is depression. They will be depressed. They have little or no smiling. Is the same as the other points, but little modification is there. Lack of proper uh, strangers anxiety. कोई भी दूसरे लोग आएंगे तो they will be very much anxious. No weight gain or weight loss. ना तो weight gain हो रही है ना loss हो रही है, stagnant है, जितनी थी उतनी ही रह गई. Next, these are diagnostic evaluations. First of all, in the diagnostic evaluation, we'll be seeing history collection. Very first is diagnostic evaluations where we will be having history collection. Like history, for what you will be collecting, you will be asking history regarding previous history. Previous क्यों पूछ लेंगे आप? Why will we ask about the previous history? So that we can get to know about the type of organic or non-organic failure to thrive, whether it is because of any medical cause or whether it is without any medical condition. Next will be physical examination, and very clearly in the pictures I have shown you all, like in the pictures like these, देख के ही पता चल जाएंगे whether the baby is having kwashiorkor or baby is having marasmus or what sort of a condition the baby is having. So physically by physically examining the baby, it will be little more clear. Observation of parent child in interaction, how you will be showing it by this. You will be showing the babies with the picture, or you'll be showing like this whether the baby and the mother, like this non-organic failure to thrive. In this we have asked about disturbances in the mother and the child attachment as well as psychopathic personality of the mother. So it is related with this. Understood? Next is, so we will be observing कि mother और child का interaction कैसा है, whether the baby and the mother both are attached towards each other or no, or only the mother is attached towards the baby, or only the baby is attached towards the mother. Next will be lab findings. Further we'll see in the next slides. First of all, we will be seeing there are certain goals to be managed by in the management. First of all, we will be seeing first goal is to provide adequate caloric and nutritional intake to these particular kids so that the child is able to gain weight in order to do what? In order to be less lethargic as compared to the previous time or previous birth weight or previous weight. Next will be promote normal growth and development. Growth and development उसकी proper हो, retarded ना हो, slow ना हो. जितनी age की baby है उतनी age की उसकी growth and development is necessary. Then assist the parents in developing feeding routines. Whatever feeding patterns they are following, a particular person or a nurse should assess those parents in preparing. Hope maybe some parents are not that much educative. They don't have, in one point we have seen no education towards nutrition or lack of education towards it, और जानकारी नहीं है अगर किसी के बारे में, so how they will do? So In that way you have to assist. Next is respond to the infant's cues of physical and psychological hunger. पहली बात आपको पता होना है, very importantly mother should know about the physical and psychological hunger. कौन सा टाइप का baby is hungry, whether baby is physically hungry that means food देना है, psychologically hungry means you have to see the baby's growth and development. If the baby is not developing properly, that is again a sign that will be dealt under therapeutic management. Under this management we will be seeing who all will be responsible. First of all a nurse, then a dietitian. Nurse would be seeing overall, dietitian will be checking about the particular child's diet, nutrition, whatever nutrients are to be given. Child life specialist, any child specialist to see and watch over all the findings and the baby's food and everything is in proper state or not. Mental health professional, these are for both mentally, because if the mother is also having some or the other issue, like mother was a if a mother is having any psychological issues, in that point we have seen which was included in the non-organic failure to thrive में. Then next is social worker. In under that we will be seeing family therapy. Family therapy will be given to the babies and as well as to the parents of the babies regarding how to take care of a particular baby, how to feed a particular baby, what all counseling sessions have been taken for those parents as well as mothers or whosoever is the first hand care provider to the babies. Next is placement of child in foster homes may relieve the family stress and protect the child. Like see over there in the first picture you can see they have been togetherly kept. Babies are placed in the particular area, and if the family is unable to, if the parents are unable to meet the demands of the baby, बच्चे को आप वहाँ पर छोड़ सकते हैं and family की stress थोड़ी कम हो जाएगी in order and baby भी protect हो सकती है वहाँ पर, उसकी nutrition के लिए भी they all will take care. Like this way also they can do. Next will be followed by medical management, after that hospitalization. Under that first and the foremost will be monitoring of growth and development. Every day full growth and development, or every 2 days proper regular monitoring of growth will be there and development will be there. In order to check growth will be monitored by doing any sort of procedure like anthropometric measurement up head, chest, mid-arm, abdomen, सारा circumference check करके you can monitor growth. How you'll be developing, how you'll be monitoring development by seeing the activities and by monitoring it कि पहले क्या कर रहा था, इतने एज का baby does like this and ये वाला baby क्या कर रहा है. So activities will tell you all. Next is treatment of organic causes. Like I told you all, ऑर्गेनिक फेलियर टू थ्राइव में अगर कोई भी चाइल्ड को कोई मेडिकल कॉज की वजह से फेलियर टू थ्राइव हो रहा है तो उसको पहले करेक्ट करना, दैट विल बी कमिंग अंडर हॉस्पिटलाइजेशन. तो हॉस्पिटलाइजेशन में हमको क्या करनी होगी, वेरी इंपॉर्टेंट, एविडेंस ऑफ सिवियर अक्यूट मैल न्यूट्रिशन की SAM जो आप फाइल में पढ़ोगे, सिवियर अक्यूट मैल न्यूट्रिशन की एविडेंस क्यों हो रही है और किस वजह से हो रही है और उसकी हमारे पास क्या प्रूफ है कि इसकी वजह से ही हो रही है. नेक्स्ट केयर टेकर सब्सटेंस अब्यूज और साइकोसिस. जो भी केयर टेकर ले रहा है, कोई केयर टेकर है फॉर इंस्टेंस मदर, वो कोई साइकोसिस में तो नहीं है और एल्स वो पर्टिकुलर पर्सन कोई सब्सटेंस अब्यूज तो नहीं कर रहा है. दैट पर्टिकुलर थिंग इज इम्पॉर्टेंट. आउटपेशेंट मैनेजमेंट दैट डज नॉट रिजल्ट इन वेट गेन. ऐसा कोई मैनेजमेंट बाहर हो रहा था हॉस्पिटलाइजेशन से पहले जिसकी वजह से वेट गेन नहीं हो पा रहा है और बेबी इज सफरिंग बिकॉज ऑफ दैट, that comes under hospitalization. I hope you all are getting my point because the topic is little vast. We can cut short also, but at the same time you all should get till here. Everybody have got the topic till hospitalization. So far we have seen what all things. We had seen just the introduction to it, definitions. Etiology में we have seen organic, non-organic failure to thrive and idiopathic. Others were intrinsic and extrinsic factors. Apart from that, other factors. And we had seen clinical manifestation on the whole. Under that, which was failure to gain weight. खाना देने के बाद भी proper gain weight नहीं gain हो पा रही है. Organomegaly, lymphadenopathy, कोई respiratory and GI issues which are recurrently happening. Then general में no loss of subcutaneous fat or no fat, or thin arms and legs, wasted body. Again, I'm repeating, it is not wasted, it is wasted. Or you can write wasting, muscle wasting, WASTING. Large stomach, red, cold and wet hands and legs. Cardiac and pulmonary, heart or lung से related, cyanosis, clubbing, respiratory distress, murmurs. Abdomen में organomegaly and abdominal distension, distended abdomen. You all can see in the very first picture जो swelling हो गई है या फिर bloating है belly में और stomach में. Skin and hair में jaundice, alopecia I told you all, it is complete or partial absence of hairs, or you can even call it baldness. Dry skin or scaly skin. Nutritional में I have told you all about kwashiorkor marasmus. Kwashiorkor is properly protein deficiency, whereas marasmus is what all three. marasmus में कौन सी three involved हैं?
हम कार्बोहाइड्रेट प्रोटीन
very good. Next is zinc, iron and iron deficiency था जिनको proper supplements नहीं मिल रहे. Next is psychological description. Under that you have seen sadness, expressionless face, general letharginess, depression, unresponsive behavior, lack of proper stranger anxiety. दूसरों को देखकर और new people को देखकर they will be very much anxious. डिप्रेस्ड रहेंगे, नो स्माइलिंग फेस, ऑल द टाइम वरीड फेस रहेगा, सैडेंड स्माइल रहेगा, दे विल नॉट बी स्माइलिंग, नॉट बी मिंगलिंग विद अदर पीपल. डेवलपमेंटल रिटार्डेशन मीन्स डेवलप नहीं हो रहा है, फुल्ली स्टैग्नेंट ग्रोथ और रिटार्डेड और स्लो ग्रोथ है. इन इट कैन बी इन एनी फेज, मोटर, लैंग्वेज, इंटेलेक्चुअल, सोशल. then these are all the same. Diagnostic evaluation में we have seen we will be observing, first we'll be seeing history, collection will be taken, physical examination of the overall baby will be done in order to check whether the baby is marasmic, kwashiorkor, कौन से type के हैं और wasting subcutaneous fat present है या फिर नहीं. Then observation will be there, the interaction of both the parent and as well as the child. Lab findings will be done. Then management will maybe goals may will be, there are certain goals like 4 important goals. Adequate calorie न्यूट्रिशनल टेक जितना है उतना दे रहे हैं तो उतना इफेक्टिव है या नहीं, और इफेक्टिव है तो कितना है, यू हैव टू मॉनिटर. ग्रोथ एंड डेवलपमेंट को प्रमोट करना, हाउ यू विल बी प्रमोटिंग, बाय चेकिंग एवरी डे और एवरी सेकेंड डे. पेरेंट्स को असेस करना है इन फीडिंग और इन डेवलपिंग फीडिंग रूटीन, उनको बताना है क्या खिलाना है, कब खिलाना है, कितना क्वांटिटी में खिलाना है. और वॉट एवर इशूज आर फेस्ड बाय the particular infant, उसको cues to respond to the infant cues of physical and psychological hunger. क्यों, कैसे, किस तरीके से उनका हंगर खत्म होना है. फिजिकल आप खिला पिला सकते हैं. साइकोलॉजिकल हंगर मीन्स वो किस स्टेट में है, whether they are depressed, whether they are happy, whether they are anxious, that you have to see. Then under that, what all members will be included in the management of the baby or infant will be nurse, dietitian, child life specialist, any, or you can write physician as well, mental health professionals, social workers. Who all are these? These are us only most of the time, but dietitian is an addition, pediatrician or mental health professional. Then family therapy will be given to everybody. Therapy may you'll be teaching them, or the people supportive or the physician will be teaching them how to maintain, how to mingle with the kids, how to give them nutrition, what all to be given. Placement of the child kahan pe, if they are not able to, if they are very much stressed enough, they can be sent to foster homes. There they can be taken care of. इससे उनका stress भी खत्म हो जाएगा और baby भी protect हो गई है. Medical management is all about regulation of monitoring of growth and development and treatment of organic cases or causes. उसमें कौन है, जो भी जिनको भी कोई medical cause है, so first we will be rectifying that, उसको correct करना है. Then we will be seeing about the normal growth and development of the particular baby. Growth how we will be measuring, by seeing the head, chest और सारी circumferences measure कर. Development how you will be checking by checking how the baby was reacting, or how the infant or how the child was reacting earlier to a particular situation, and now how he or she is reacting. So वो development में you can check that way. Hospitalization, as we had seen, evidence of severe acute malnutrition. You'll be checking कितना body weight है और कितना body mass है. That means fasting है या नहीं है, weak है या फिर नहीं है तो कितना है. केयर टेकर सब्सटेंस अब्यूज और साइकोसिस, जो भी केयर टेक जो भी उनके हेल्प कर रहा है, और स्पेशली मदर और फादर, उनको कोई सब्सटेंस अब्यूज तो नहीं कर रहे हैं, वो मींस इफ दे आर आल्सो नॉट टेकिंग पार्ट इन एनीथिंग, वो खुद ही न्यूट्रिशियस सब्सटेंस नहीं खा रहे हैं, तो हाउ द बेबी विल, द ब्रेस्ट फीडिंग बेबी और द फीडिंग बेबी उनको क्या ही करेंगे. आउट पेशेंट मैनेजमेंट डज नॉट रिजल्ट इन वेट गेन, जो भी बाहर से जो भी मैनेजमेंट हो रही है उससे बेबी का वेट गेन होना इज नॉट मैंडेटरी, कि बाहर से हम कुछ भी कर रहे हैं उससे नहीं. जब तक इंट्रिंसिक, यहाँ पे आ रहा है किसका काम, इंट्रिंसिक एंड एक्सट्रिंसिक फैक्टर, जब तक अंदर से नहीं खा रहे हैं, अंदर की चीजें सीखनी है, तब तक बाहर से कोई आउटकम नहीं आएगा. कोई ऐसी लोशन तो है नहीं दैट वी आर अप्लाइंग एंड एकदम से वेट गेन हो रहा है, एकदम से मसल मास आ जाएंगे, नो नो. सो सिमिलरली इन दैट वे. Next, nutritional rehabilitation. From here we will be seeing tomorrow, because it's a little vast topic. This all prevention will be there, process will be there. This all, and the level of prevention, surgery will be there. These all topics, how guidelines will be there, like nutritional rehabilitation, how to educate the mother, and all. How far we had seen, everybody have jotted down. If you all have not written, I will be sharing this particular PPT once the topic is over, that is tomorrow, on your WhatsApp group, whatever group we have. Okay, any doubt you all can ask now itself. Till now, any doubt you all have? I have summarized so far, twice I have summarized. If you all want me to summarize again, I will do so. If you all have any doubt, please you all can ask. Any doubt in any number, in any PPT number, you all can ask. Fareen, you have any doubt?
मैम
No, ma'am.
बता दीजिए.
मैम एक बार आप पीपीटी सेंड कर देना.
हाँ, I will send, but any problem right now you have, you can please ask. Tomorrow I will share once the topic will be over.
मैम एलोपेशिया बता दीजिए.
Alopecia, that is partial or complete absence of hair. जब किसी की बॉडी से जहां पर हेयर ग्रोथ हो रहा है, स्पेशली हेयर का पिक्चर आई शोड यू ऑल, वहां से जब बिल्कुल लॉस हो जाएगा, हेयर ही नहीं बचेगा, या फिर बार्डलेस, या पार्शियल मीन्स या तो आधा, कंप्लीट मीन्स पूरा. जब हेयर लॉस नहीं रहे, हेयर लॉस रहेगा, दैट इज टर्म्ड अंडर, and that comes under alopecia, which is also known as baldness, which means absence of hair or partial absence of hair. ठीक है, किसी किसी को देखा है ना, एज्ड पीपल, आधे हेयर्स हैं, बीच में से गायब है, किसी किसी के पूरे ही गायब है. सो दैट इज बिकॉज ऑफ सर्टेन एज. यहाँ पे क्या है, बच्चे को ही हो रहा है बिकॉज ऑफ क्वाशियोकर एंड मरासमस. अंडरस्टूड? एनी डाउट?
यस मैम. नो मैम.
Bindu, any doubt you have? Okay, then we will wind up the session. Tomorrow again we will meet by the same time. Please study and come. Don't forget to study and come. Tomorrow I will definitely share and I will ask you all to summarize. Okay? Now you all can leave. Thank you. Fareen, please send me the screenshot of the attendance, please. Before leaving, please send me the screenshot.
Okay.
Okay, thank you.
Okay, ma'am.
अच्छा